Harm reduction at its essence is abandoning perfection. We really should always be abandoning perfection. By definition, none of us can be perfect. Meeting people, helping them make positive change in their life, and not judging them for being unable to make a ginormous leap of change, which is abstinence from substance, yet encourage them for every small change they make is just the same as what we do for ourselves with seeking excellence. So seek a small improvement every day.
Harm reduction, I believe, is like at the root of it, like destigmatizing the use of substances in general. The more taboo something is, the farther you drive people into the shadows to do that, and the more unsafe it becomes.
One of the things that really connects me with my work here is the ability to impact change. As a single physician caring for a patient in front of me, I can impact that single patient's care. But if I'm supervising a team of 16 to 20 paramedics and 100 EMTs, we can really make systems changes that have better outcome.
Both of my parents and their parents have struggled with alcoholism, and so it felt like something I needed to overcome in this life. I'm a drag performer and I'm a clown, and that gets to how I combat loneliness and isolation out here is by being out there, by being bold with my spouse, by being gay and trans publicly and trying to uplift my community. I believe that people are people and not the substances that they use. Modeling language without stigma is important, and even a small step to help start addressing harm reduction here.
The West Coast, and in particular the Pacific Northwest, have seen an enormous increase in deaths from opioids. In King County, overdose deaths are more frequent, more common cause of death than car crashes, than violence, than cardiac arrest. At the national level, substance use, and in particular opioid use and opioid poisoning, it's one of the leading causes of death in people under age 40. And so it really is an epidemic, and it's at that level. It is a public health emergency.
There's folks that are on the harm reduction side that are like, live and let live, like we're gonna support community members no matter what. And then you've got other folks that are like, absolutely not. I don't deal with people that do this, and like I can't. Especially in a marginalized community, it's really difficult to have that stigma in addition to already living with the stigma of being gay. My one best friend is Black and gay. He's had to really fight to feel any dignity and respect and honor in this community.
Stigma is, to me, the bias that we bring, sometimes conscious, sometimes unconscious, to our communication with people who use substances. And I think that really makes those people feel unwanted, unloved, uncared for. It's challenging in the rural environment to provide services, but overall I think public health is doing a great job. If people are interested in using medications to reduce their use, that's available at Jefferson Healthcare, Discovery Behavioral Healthcare, Olympic Peninsula Health, which can also be accessed through Believe in Recovery. There's also peer groups, so lots of groups of people with lived experience or people with living experience who are using substances who want to support each other.
It doesn't even occur to me to not meet folks with love, because that's what I would like in return. There's a changing tide to help folks instead of just literally leaving our community members like down and out. That is beautiful and powerful, and something that needs to be reflected more broadly.
I'm excited by opportunities for sort of new therapies, new medications. I'm excited that our government is unrestricting access to some of these medications. It's a grandmother who wanders by at the farmer's market and says, maybe I should have this just in case I'm near someone who has used a substance that's rendered them unconscious. I can use this. I'm starting to see that shift in culture, which is impressive because I've only been here a few years, and seeing cultures change over a few years gives me hope.